Hello, I'm Dr. Margaret Ames, and you're listening to Your Dental Health. I want to start out today by thanking all those people that have called my office and come in for an exam. The response has been overwhelming. I really appreciate that you got it. You got the message, because one of the missions, one of the goals of my show is to get the word out about biomimetic dentistry. And for some people, it just resonates. So those of you that have made appointments, those of you that I've seen, thank you from the bottom of my heart. You're really getting it. And everybody that's been in has said, wow, I've never gotten an exam like this before. That was amazing, like in my whole life. So the other goal of my show is for you to experience more comfortable and less invasive dentistry and beautiful dentistry. I'm going to talk a little bit about that today. I can be reached in my office at 631-261-4525. That's 631-261-4525. I've been practicing dentistry in Huntington since I was pregnant with my daughter, and she's 21 now. So I've been there a long time and really enjoying it. I love the practice. I love my staff. The experience that you have when you come into the office is really calming and pleasant. We take the time to get to know you. I want you to get to know me, and I want to get to know you so that we can have a good back and forth relationship. Is it going to hurt? That's what most people want to know. Is it going to hurt? It's not going to hurt. If you have any gingivitis where the cleaning might hurt you the first time, we're not going to do that. We're going to give you a prescription that will start to control that gingivitis so that we can go and do a thorough cleaning. We're going to show you how to clean your teeth more effectively, because gingivitis is associated with heart disease. The inflammatory cells that exist in an inflamed situation in your mouth travel in your bloodstream, and they make your cholesterol lay down and form the plaque on your coronary arteries. That's really not a good thing. You know that leads to heart attacks. So I want to tell you about a few of my patients. One of them was in this week, and he had been in before, and he said, I met him, and he happened to mention that he needed a dentist. So he made the appointment. He came in. He said, I want it done fast. I want it, because I always fall off the wagon. So I want you to do your thing, do as much as you can in one visit. So I said, okay, sorry, Rick, we have to start out with a complete exam because I don't want to overlook anything, and I want to make a lifetime plan for you. You may not have to do it all at once, but why don't you come in and I'll take a look. So he came in, I made a plan. He had one tooth that the decay was so near the nerve, it was kind of scary. So I had to do that one first. And when he came back in, the tooth has no symptoms. He's absolutely fine. And he even forgot to take the Advil that I told him to take, because if your decay is really near the nerve, we want to quell those inflammatory cells. So anyway, he has a space between his two front teeth. So I mocked up, I did like an architect's rendering in his mouth of what his teeth would look like if we closed the space. He loved it. As a matter of fact, he left the office and called back about an hour later, and he said, I have to get in for her to close that space. I have to get in. So he came in the next visit. We closed the space, one visit. Some would say, let's do 6 veneers on your front teeth. I did this without drilling any of his own tooth structure away. If he decided, I liked my space, I really, I want it back, we could take off all the bonding and he would be back to his old self. I think his wife is really happy. So for less than the cost of one veneer, we did 2 teeth in one visit, and he looks great, and we saved all of his enamel. So I want to remind you that my motto is, if 20th century dentistry had been so great, there would be no such thing as redoing a crown. There would be no such thing as an implant or root canal therapy. This is my passion. You don't have to have aggressive drilling. Minimally invasive dentistry is here. In many cases, you can have the decay removed by sandblasting without any Novocaine. I'm really passionate about this stuff. Please join my practice. So I'll tell you about another patient besides Rick. Her name is Jane. She was just in, and every time she comes in, I remark that her lower front teeth are so perfectly straight. Most adults, there's a little bit of crowding in the lower front teeth because the forces come from the back of your mouth, and they go toward the front, and they cause the teeth to shift and get crowded. And the one that's crowded forward goes forward, and it hits your upper front tooth, and that starts to get crooked. So if you want to stop that progression and not look 50 when you're 50, it's a good thing to come on in, let me take a look, and correct that for you relatively easily most of the time. So Jane has this naturally, and I just sit back and I enjoy it. I say, Jane, I just love your lower front teeth. Most of us don't have that. So that can be corrected sometimes through Invisalign and sometimes through even more minor treatment. So don't let your teeth get crowded like that. You know what? There was a study done of Aborigine skulls. So this orthodontist in Australia had analyzed these skulls, and he found that the Aborigines had no crowding of their lower front teeth. That's kind of rare. So the reason is because they ate such rough food that their teeth moved against each other side to side, and their teeth became thinner over the years. That's probably what nature wanted, was for us to eat like that, but we don't. We eat more easily chewed foods, so we do get that crowding, and it's worth it to correct that. So then Leanne came in. Leanne is a lovely young lady. She's about 18. She had some wear on her lower front teeth. She wore all the enamel off the edges, and there was like a little brown line where you could see the dentin. And her teeth were overlapped in the front a little bit, just a little bit. So we took some photographs and took a look at what was going on, and you could tell that that crowding was going to continue to exist. And by 30, she would have a mess. So I shouldn't say that because I asked her to tune in to the show today. So we're going to do Invisalign on her. We're going to make everything so straight that she will not have the colliding that occurs when your teeth hit against one another. So then, I wanted to remind you that if you've just tuned in, you're listening to Dr. Margaret Ames with Your Dental Health. The mission of the show is to get the word out about biomimetic dentistry, a major paradigm shift in dental care, and for you to experience more comfortable and less invasive and beautiful dentistry. I can be reached in my office at 631-261-4525. And I want you to know that if you're a celebrity type and you need anonymity, you need privacy when you come to the office, we arrange that for those that don't want to be sitting in the waiting room with anybody else. So please call the office and we'll be happy to accommodate you and fit it in with your schedule. Because if you're one of those people that people would say, oh, aren't you so-and-so? That's not the way it works in my office. Of course, you probably know John Gomez from his weekday shows from 12 to 2. He revealed on his show that he's my patient, and he doesn't mind sitting in the reception area because nobody sits in the reception area for more than 5 minutes. We get you in on time, and you're back and you have your privacy, and it goes really nicely. So who else was I going to tell you about? Oh, I wanted to tell you about the annual meeting of the Academy of Biomimetic Dentistry. I was the founding president. That was for the previous 2 years. And we had our meeting in Reno, Nevada, and it was a big, big success. So one of the people that I hired to video the conference was a man from Mankato, Minnesota. He's wonderful. I hope to have him on the show so that he can talk to you about his experience. But he is absolutely an amazing and smart young man, and his videography, he's a documentarian actually. Let me think of the name of his website because he's excellent. You have to look at his videos. I can't think of it now. TrueFacadeVideos.com. So he was out there for 3 days videoing the whole conference. At the end of the first day, I met him in the lobby in the evening, and we talked over how the day went for him. And he said, oh yeah, everything went well. I got the slides, I got the lectures, like the audio's great. But he said, I have to tell you something. I can never go back to my dentist. This stuff is really important, this new biomimetic way. I really got what those speakers were speaking about. Now, those speakers were speaking to dentists, and they were showing videos of how the tooth moves, how it bends and flexes, and the importance of not capping a tooth with a whole crown and keeping the tooth from being able to flex the way it normally does. And the gap underneath the crown that exists when you put a crown on. The best crown in the world has a micro gap, which 6 germs can fit underneath. That's not a good thing. So if you've been told that you need a crown, please come to my office for a second opinion. I can show you what it's all about. I can explain it to you, and you can avoid the amputational treatment of a full crown restoration. So I'm going to take a question that somebody emailed into me. They asked me how safe are dental x-rays. In our office, we use digital x-rays, and the x-rays, we only take the necessary x-rays, and the x-rays are less than half of the radiation of a typical x-ray. So the kind of treatment that you'll get in my office is personable, one-on-one, minimally invasive, minimal x-rays, minimal cutting away of tooth structure, and overall respect and good rapport with all the staff. So please, I'm passionate about this. Call me. You can reach me in my office at 631-261-4525 or on my website at drames.com. That's drames.com. Thank you for listening. See you after the break.
When you give me that pretty little pout, it turns me inside out. There's something about you, baby.